vulnerable groups, commercial sex workers, men who have sex with men. We have done various studies, and hence the Jamaican program is highlighted internationally as one of those which is evidence-based. All our interventions are based on evidence which we have documented locally here in Jamaica. We have had several mass media campaigns geared at improving. Gone again. Just press any button. We have had several mass media campaigns geared at press escape. Technology. Yeah. So one of our major campaigns have been the abstinence campaign, which a number of you have seen. Hold off, sex can wait, and I think this has been having some major impact over the last few years. We have done our PMTCT campaign, which now testing of HIV pregnant women is a standard. We do it for your baby. If you're pregnant, get tested. And our antiretroviral campaign, which has looked at I'm in control, not HIV, encouraging persons to take their antiretroviral drugs. VCT campaigns looking at things you should know. You should know your partner's status about HIV. And we have had various condom messages, and our previous anti-stigma campaign looking at changing the face of HIV. And I think this campaign really made a major shift in Jamaica. Nowadays, when you see, in the video you saw persons looking ill, cachexic, etc., lying in bed. Nowadays in Jamaica, this is the face of HIV, not the one of illness and wasting, but people looking normal, healthy, living and getting on with life. Mm-hmm. In the treatment program, we have been able to put over 6,000 persons on antiretroviral drugs compared to about 500 in 2004. So we have really made remarkable strides in putting this on, and this was supported through the Global Fund. And because we have been able to do this so well, in an analysis of the 130 Global Fund projects across the world, Jamaica was ranked 7th out of all of those. We have all the latest antiretroviral drugs in Jamaica, and you've seen where other countries are having challenges with second-line drugs. In our latest bid, we have been able to cut the price of our second-line antiretroviral drugs by up to 70%, and I think now Jamaica is having the lowest price in the world for most of these antiretroviral drugs. In line with that, we have seen a 17% decline in reported AIDS cases in 2008 over 2004, and we have had a 40% decrease in reported AIDS deaths in the 2008 over 2004 period, which was a tremendous achievement. There is also a marked decline in pediatric AIDS and pediatric AIDS-related deaths, and if you look at this graph, it speaks for itself. We have seen marked declines since the introduction of antiretroviral therapy for the prevention of mother-to-child transmission in 2004, 2002, 2003. And we have been using triple therapy from at least 3-4 years now. And yesterday, the World Health Organization have revised their treatment guideline to match what we have been doing for the last 2 or 3 years. Not that we're the only ones doing it, but we have been able to foster a multi-sectoral response, and we have had programs with the Ministry of National Security, and we have institutionalized HIV screening of inmates with approximately 600 inmates tested per year. Ministry of Labor and Social Security, institutionalization of HIV screening and HIV sensitization, focusing on risk reduction for the migrant workers. And as I said, the Occupational Health and Safety Act. We have a major partnership with the Ministry of Education in developing and implementing the Health and Family Life Education Program. And I think this we fund through the Global Fund grant significantly. We have about 25 subrecipients, which are NGOs that we support directly from the program. And each year we give sub-grants of about $200 million to these NGOs to implement their activities in the communities. We have a strong association with the business sector, and we have worked closely with the Jamaica Employers Federation, Jamaica Business Councils, and the Jamaica Manufacturers. We have managed to engage leadership at the highest level, and again, you can see from this morning, this is the Prime Minister and the opposition Dr. Fenton Ferguson signing publicly the ILO workplace principles, and we have been, through the NAC and other groups, we have been able to engage various lawyers who provide pro bono work for persons who are victimized or HIV infected. And we have even managed to get the Prime Minister of Jamaica to test publicly for HIV/AIDS. This is a tremendous show of leadership. In a number of countries over the past years, the Prime Ministers sometimes don't even come to the functions, don't acknowledge and don't associate with HIV issues, particularly in some of the African countries. And I can remember one year we were in Canada, and it was a big uproar because we had a major event, the entire world was there, and the Prime Minister didn't come. So we need to congratulate the support that we have. The HIV program over the last years have been able to maintain a consistent A rating from the Global Fund, and we have been able to raise over $82.4 million through proposal writing. This is not money that's sitting out there to be handed down to Jamaica. It's a lot of hard work that is required to write the proposals and get the approvals to get these monies here. It is becoming more difficult as Jamaica is now ranked as an upper middle income country, and hence we have to really justify why we should get some of these monies. And we have therefore some funding of 7.34 billion Jamaican dollars up to 2014. The majority of this, however, provides for antiretroviral drugs, and we have to see how we go. Keep in mind, I mentioned at the beginning that the overall strategic plan for 5 years is costed at $200 million. So we're basically still only 43% funding. We have recently written a new proposal to the Global Fund for 17 million Jamaican dollars, and this will help us with 17 million US dollars, sorry. And this will help us with this will help us in the fight with TB, HIV, and some work in strengthening the lab capacity in the country. I was hoping to have the result of this today, but unfortunately they still have not decided on the result. Some of the factors we still face driving the epidemic, the issue of multiple partnerships that we need to tackle, where we're seeing men reporting an average of 6 partners and women 3. We have the issues of transactional sex, where 27% of the population are reporting exchanging gifts or sex, or money for sex, and we have a high prevalence rate among our commercial sex workers, where approximately 9% of them are HIV infected. We have the issue of men who have sex with men and the issue of stigma, and if you look at this graph, you can see that Jamaica really has one of the highest prevalence rates among men who have sex with men in the Caribbean. So this is Jamaica, top Guyana, Trinidad, Dominican Republic, Bahamas, Cuba, etc. So we have a serious problem that we have to deal with. What are some of our future interventions? We practice what we call combination prevention, or highly active HIV prevention, which includes behavioral change, treatment, biomedical strategies, which include vaccines, microbicides, and the social justice and human rights reform system, all with the involvement of the community and leadership and scaling up of treatment and prevention efforts. So in moving forward, we are trying to encourage men to get tested. We find that they present late, and we are not only focusing on the young, typical Jamaican male, but we are also now looking at some of the older males to see if we can reach them and targeting them to get tested and know their HIV status. Yes, I Can Support Persons Living with HIV is our new face, and we are moving forward in a new era, looking at showing different faces, different persons from different societies, different communities, uptown, downtown, middletown. Everybody is affected by this disease, and we want to help to normalize. The issue of the food, we still have an issue where persons believe that you don't eat from persons who are HIV infected, etc. And we want to dispel that myth, and hence Rosie and all the lovely food. So I can support someone living with HIV. Thank you.